to Health Forum Session 5, organized by Canada, India, USA Development Forum, a Brampton, Ontario-based not-for-profit organization since 2010. The ongoing pandemic has made life very difficult for millions of people and businesses everywhere. Hundreds of thousands of people have lost their jobs, businesses have closed down, people's life savings are gone, and of course, millions of lives are also lost globally. All this has created severe mental and physical health issues for people with a very real danger of very long-term damages. How do people find the right information where they can go to find the help and the resources to cope with that? These are the questions that we are trying to address through this 12-part virtual health forum. Over the course of these 12 sessions, we are bringing together over 100 experts, doctors, medical officers, frontline workers, mind body wellness experts, nutrition, diabetes, mental health professionals, mayor, city and regional councillors, and various other professionals. The Health Forum 2021 is supported by City of Brampton's Advanced Brampton Fund and co-sponsored by Trudy Financial, Greens Life Sciences, Blue Umbrella Financial Services, Best Ayurved, Dentistry on 10, Process Research for Tech, Tangentia, and Kotak Personal Injury Law. We would also like to thank our partner organizations, PCHS Foundation and Sunoh, as well as our Health Forum coordinator, Tejas Aivalli. I am your host, Vipul Jani, President and CEO of Canada, India, USA Development Forum. The topic for today is mental health, anxiety, and how to cope with it, especially during a pandemic. Before we begin the session, let us take a quick look at the forum and the work we do. Today's session is also live on Canada, India Insight Facebook page. So Canada, India, USA Development Forum, or CIUDF, is an Ontario, Canada-based not-for-profit organization working to promote bilateral and trilateral relations between Canada, India, and USA. CIUDF organizes events, conferences, and speaker series lectures with prominent corporate and political leaders in all three countries for ideas exchange and knowledge sharing. The forum recently opened up for memberships, and 21 companies and professionals have joined us as members in the last 3-4 months, with the goal to raise the membership to about 300 or more by December 31st next year. CIUDF also hosts virtual member meetings, and as the pandemic measures are now being eased gradually, we will soon be hosting in-person brunch meetings for members and sponsors, as well as go back to live in-person events and conferences. These are some of the activities that we do on a yearly basis. We host an annual Canada-India Insight Conference with cabinet ministers, presidents and CEOs of large corporations from both countries, as well as a Canada-India-USA Trilateral Conference. We host several business leaders roundtables, a lot of political leaders roundtables as well, with MPs, MPs, again from all three countries. Membership expansion, as I just mentioned. A lot of member networking events, right now virtual, but hopefully we'll go back to in-person events soon. We have also started a Consul General's Roundtable between Canada, India, and USA. We have also recently, 3 months back, started an education forum where we are reaching out to presidents, deans, registrars of prominent colleges and universities. Again, mostly in Canada, but also from the US as well as in India as well. The Health Forum, which we are right now doing, this is the session 5. There will be 12 sessions as part of this virtual forum. But looking at the information, that we are getting, that we are sharing, I am very much inclined to make this also a permanent endeavor, even going beyond, the existing conference. We also have a Canada-India Insight e-paper, as well as we do several webinars and virtual sessions on current affairs and issues of importance, like the one we did on Keystone with Alberta, with Ontario, with Punjab, things like that. So with that, let us introduce our first speaker of the day, Dr. Maher. Okay, let me, yes, I already recognize the support. So let us have our first speaker for today, Dr. Maher Hussain. Dr. Maher Hussain is a physician and psychiatrist from India. He obtained his MD in psychiatry from Madras Medical College, Chennai, in India, on an American government scholarship, Howard Humphrey Fellowship. He successfully completed his Master of Public Health degree and postdoctoral fellowship on drug abuse from the Department of Mental Health, the Johns Hopkins University, Baltimore, USA. He has many presentations and publications to his credit in the field of addiction and mental health. He has vast experience in the areas of mental health, addiction, stress management, and public health. He is the CEO and director um, of clinical services at South Asian Canadians Health and Social Services. He is the director of mental health and addiction services and provides the mental health and addiction services at SACHSS, which is the South Asian Canadians Health and Social Services. He is also the editor of SACHJ, the short forms, South Asian Canadians Health Journal, published by the South Asian Canadians Health and Social Services, and is also the head of the research and training programs at the institute. He also serves as a mental health and addiction consultant in many organizations. So over to you, Dr. Hussain.
Thank you very much for Mr. Vipul Jain for the introduction and also inviting me for this forum. It's nice meeting all of you. So I'd like to make a brief presentation. So I'll share the regarding mental health and stress and anxiety during this COVID-19 times. I will share my screen with all of you.
Yes, please go ahead.
So like Mr. Vipul already explained about our organization. Our main services are health education, health promotion, mental health, addictions, and also related services such as stress management, anger management, healthy living, and other programs. He already introduced me. So regarding first, I'll give a brief introduction about the mental health issues and stress because of COVID-19. Even though the situation is improving now, still we are not back to normal conditions, and still people they face with the issues of isolation, loneliness, boredom, forced inactivity, loss of job, reduced work hours, financial issues, and also they have sometimes there's lack of scarcity of food and materials available, and some people they go through fear of contracting COVID-19 for self or for their loved ones, and they also have a stress of dealing with people who already have COVID-19 and go through their illnesses, and many of them they have also lost their loved ones, and also small little things like shopping and socialization. All those things have become a big stress, and because people will just stay at home, there are also conflicts at home with other family members. We do find a lot of issues such as domestic violence and other issues because people stay together they're forced to stay home together. Sometimes they get into a lot of conflicts, especially when there are already conflicts going on. And also the stress, it also leads to other issues such as anxiety, depression, and other issues. So these are some of the things people go through. And for depression, also the things such as uncertainty, stress, and loss of job, and negative thoughts and despair, despondency, all those things lead to contribute to depression as well. Anxiety is a big factor in this one, and up to 45% they have been as reported to be having some symptoms of anxiety, sleep disturbances, and stress. And it's studies in Canada and many other countries, USA and many other countries. They have reported a lot of incidents of depression, anxiety, depression, stress, and other mental health issues being faced by people in general population, and also people faced by people who are undergoing suffering with COVID-19, and also where their family members or loved ones they suffer from COVID-19 have also lost some of them have lost their loved ones also. So then the mental health issues, there are many causes like biological, psychological, and social. This COVID-19, it has contributed to all those causes. And then there's a lot of things which you can do for prevention. We'll come back to it. And also the stress, managing stress, it includes maintaining good physical health and maintaining good mental health. Maintaining good physical health, it includes healthy food, exercises, relaxation, self-care, developing good positive health, positive physical health. And also people who already have illnesses, they have to take good care of prevention and care of chronic illnesses such as diabetes, blood pressure, heart disease, arthritis, cancer, etc. Especially when people are under stress, they tend to ignore their physical conditions and mental conditions that contributes to even more severe issues. So it's very important to take good care of their illnesses as well, to have a good healthy life. It's very important to get good health care and medications and to have good treatment and follow-up. Similarly, good mental health, it also includes managing stress and relaxation activities, maintaining good relationship with others, and also similar to physical illness, it's also very important if people already have some mental health issues. It's very important to take care of their mental health issues also, such as anxiety, depression, psychosis, and other stress-related disorders. Healthy living includes good physical health and good mental health. Healthy body has a healthy mind as well. So as for managing stress, it's something very important in managing the mental health issues. Stress is whatever that causes pressure and tension in us. That's called stress, and it can be mental health, or it can be physical health, or it can be any other causes. Stress is a common problem that affects all of us. So there are some also to find out if you are stressed or not. If you have trouble sleeping, or if you are unable to relax, or if you are forgetful, or if you are easily become angry and irritable, if you feel under pressure, and if you keep arguing even about minor small things, and if you don't find time for yourself or for socialization, all those things indicate that you are under stress. Some of the common sources of stress are pressure from family and work, conflicts at work, at home, and problems in physical health, mental health, finances, relationships, work-related pressures, time pressures, caring for others who are in need. if someone in our family is not doing well, and if you're taking care of someone, taking care of others, it causes a lot of stress. So these are some of the things which causes stress. And how do you deal with stress? When we deal with stress, there are two important things. One is dealing with immediate stress relief, and another is long-term strategies. Dealing with immediate stress relief is dealing with immediate issues and immediate problems to get immediate relief from the stress. Then one has to work on long-term strategies to prevent stress and to have a stress-free life. For immediate stress relief, there are some things one can do. One is taking some few deep breaths, and then relaxing your muscles, walking around, and making a change. If something is stressing you, it's very important to have a break and have a change from that, and spend time on something else. And laughter, humor is a good stress reliever, and learning to laugh and taking things lightly and watching comedy shows, comedy movies, all those things, they help as well. These are some of the short-term stress relief. Then we'll go to long-term stress relief. Long-term stress relief, it includes regular exercises and spending time on hobbies and activities, also stopping smoking and eliminating or reducing caffeine. Having tea or coffee once or twice a day is okay, but having too much coffee or tea also, it has a lot of caffeine, and also it stimulates the mind and the body, and it causes stress-like symptoms. So anything in excess is not good. So even tea or coffee, 1 or 2 cups a day is okay, but having excessively is not good. Then healthy food and regular sleep, and having good rest and good sleep, and relaxation techniques, following relaxation techniques, and avoiding alcohol and drugs. Alcohol and drugs, people, they use it to deal with their stress and also emotional issues. But even though they give temporary relief, it causes a lot of problems, more severe problems in mental health, physical health, and also in family and relationships. So avoiding alcohol and drugs is something important. And even small amount of alcohol and drugs, they change the way a person thinks and behaves. It causes a lot of relationship problems and issues. That causes again a lot of stress and anxiety and depression and other things. So even small amount of alcohol or drugs, they change the thinking and behavior. So it's very important to avoid that altogether, alcohol and drugs. So some people, they do use alcohol and drugs occasionally and socially once in a while. Even using once in a while, sometimes it can lead to more regular use, daily use, addiction and abuse. So for that reason, it's better even to avoid occasional or social use. And also another thing is, even occasional or social use of small amount of alcohol and drugs, like I mentioned, it still changes the way a person thinks and behaves and causes a lot of issues and problems. So that's one of the reasons it's better to even stay away from occasional or social drinking. Another problem with occasional or social drinking is people who already have alcohol or drug problems. So the main problem is they have loss of control. They cannot stop with one drink or a small amount of drug. If they have one drink, they have to keep going. They cannot stop, because the main problem with people who have alcohol and drug problem is loss of control. So for that reason, when people abstain from alcohol and drugs, it's very important to abstain completely and not to have any even one drink at any time, because even if they have some occasional or social use, they cannot stop with one drink or a small amount of drug. They have to keep going. So for that reason, it's better to stay away altogether from alcohol and drugs. Then again, dealing with stress, it's important to identify what is causing the stress and to deal with those issues so that we don't have those things don't happen again and again, and they don't become a cause for constant stress. Then reducing the intensity of our reactions. Some people, even small things, they take it as a big, huge issue and a serious problem. They become very worried and very concerned. They become irritable and angry, and it causes a lot of issues. Many people who take even small things as a big things, and there are other people who take even big things, serious things. They take it in a light way and deal it with in a light way. They don't become too much upset. They take it as a way of dealing with things which happen in life. Uh, so the second way, that taking things lightly and dealing with them lightly, and not becoming too upset, and taking as a fact of life. In life, even things happen in life which we do not expect to happen and which we do not want to happen, but this is life, and things happen in life. So taking those things as a way of dealing with life in general, in more philosophical way, it helps a lot. So this is a second way of the second kind of attitude, where people take even big things in a lighter way and deal with lighter way. It's a very good attitude to have. Whereas the other attitude, where even people take small things in a big way as a big thing, that's not a good attitude to have. So our way of reacting to the incidents and events and the way we take things, so that's also something very important. So that your attitudes and obligations, and those are important. And being organized, it saves a lot of time and a lot of stress. And then developing good emotional supports and maintaining good relationships, all those things, they help a lot as well. And then letting out emotions in a safe way, in a healthy way, that's good. Uh, Laughing, crying, all those things are good. If you are upset, it's better to talk to people and let out your people who are supportive of you, and let out your thoughts, feelings, and emotions. When you share your thoughts, feelings, and emotions with people who are supportive of you, it helps a lot. Then healthy sex life, that's also important part of managing stress. If there are any issues in sex life, then now there are a lot of good medications and treatment available if there are any issues in sex life, which help a lot. And healthy sex life includes practicing sex, and avoiding unwanted pregnancies and avoiding sexually transmitted diseases, HIV, AIDS. That's also important part of a healthy life. So it's also very important to try out different ways of dealing with stress. Whatever works best for us, that's the best way of. That's the best for us. And time management, it saves a lot of stress and time if you manage time effectively. There are a lot of tips for managing stress, which I already mentioned. This is just a summary of all those things. And another thing which helps is helping others, volunteering, and getting away for picnics, day travels, vacations, regular exercises. All these things are very important. Then regular relaxation exercises, which are important. Regular relaxation is, we have to set aside some time for relaxation activities, otherwise you don't get time to get to it. We have to set aside at least 10-15 minutes or half an hour per day, and spend time on relaxation activities, which includes walking, running, jogging, regular exercises, meditation, yoga, hypnosis, tai chi, biofeedback, massage, hydrotherapy, saunas, music, listening to music, all those things. They are very good ways of managing stress. And relaxation techniques also include deep breathing exercises and meditation. When you do them on a regular basis, it helps a lot in managing and avoiding stress. And mental exercises also, in addition to physical exercises, mental exercises also keep mind active and healthy, and also helps in preventing and delaying some conditions such as dementia. Mental exercises using puzzles, using the hand you normally do not use, using the opposite hand, challenging your brain to new task and novel task. All those things are good mental exercises. And also some games and activities, they also can be a good mental exercise, playing chess and other things. So finally, religion and spirituality. For a lot of people, the religion and spirituality provides a lot of moral support and psychological support. So spending time on religion and spirituality and prayers and meditation and going to temple, mosque, church, gurdwara, all those things are very good ways of relaxation and managing stress. So this is the final religion. Spirituality is the final thing I wanted to add. Thank you all very much for listening to the presentation. Thank you.
Thank you, Dr. Hussain. That was a fantastic presentation. I must say, you covered pretty much every aspect of it. The stress points and how to address them. Once again, thank you very much. That was really, really very helpful.
Thank you, Matt. Actually, it was a long presentation. I made it short for the time.
Yes, but we'll be happy to forward it to anyone that wants it. All right, so that brings us to our second speaker of the day, Nainesh Kotak. Tejas, if you can bring up the introduction. Okay, so Nainesh Kotak, our next speaker. He is a barrister and solicitor. He holds a wealth of experience, having appeared in trials with and without a jury at the Superior Court of Justice and the Ontario Court of Justice. Nainesh Kotak has represented clients and conducted appeals at the federal court level, trial division. Nainesh has appeared before numerous tribunal panels, including the Financial Services Commission and the Social Security Tribunal. He has been featured in several televised, print, and radio interviews on the subjects of personal injury and long-term disability claims. Nainesh's practice includes long-term disability cases for clients suffering from depression, anxiety, and post-traumatic stress disorder. He is very active in the community and supports many worthy charities and causes. Actually, if you are living anywhere in GTA, I mean, it's a very, very well-known name. There will hardly be anybody who doesn't know Kotak law. From 2015 to 2019, he brought 1,000 troops, veterans and cadets to a professional hockey game in a Remembrance Day event known as Kotak Law Military Appreciation Day. So, personal thank you for that, Nainesh bhai. He is a very proud contributor and supporter of Wounded Warriors Canada, the Canadian Mental Health Association, and Everymind Mental Health Services, formerly Peel Children's Center. Nainesh was appointed by Sheridan College to the Paralegal Advisory Committee. He serves as chair of the long-term disability section of the Ontario Trial Lawyers Association. He is also on the board of directors of the Ontario Trial Lawyers Association and is part of the executive of the board. Nainesh Kotak is president of the board of directors of Everymind Mental Health Services, again, formerly Peel Children's Center. So over to you, Nainesh bhai.
Thank you so much, Vipulbhai, for inviting me here today and to speak and meeting the other guests today. So what we do know is this unprecedented pandemic has affected really every aspect of people's lives, in particularly people's mental health. And this includes an increase or an exacerbation of pre-existing anxiety, depression, post-traumatic stress disorder, obsessive compulsive disorder, and other stress-related mental health concerns. With that has arisen really legal issues, the access to justice component for people who are suffering mental health conditions, and to sort of maneuver their way through dealing with the legal system when the legal system itself was brought to a bit of a standstill, particularly at the outset of the pandemic. So in our practice, in my practice, we represent many clients who have anxiety and depression. So we have seen firsthand the effect of the pandemic on people and on their right to benefits that may ordinarily have been available to them. In particular, I'm talking about the applications for various forms of disability benefits due to their inability to work for mental health related issues. And these could be group policy disability benefits, private policies, or even Canada Pension Plan disability benefits. What we have found is that particularly in the beginning months of the pandemic, the summer of 2020, we saw a tremendous increase in claims. People were dealing with such significant stress, the inability to continue with employment, whether it be at the workplace or in fact from home. We saw many claims denied on the basis that, well, there's insufficient medical evidence. Your claim is subjective, because often insurance companies look at mental health claims as being subjective. You cannot see them with an MRI or a CT scan or an X-ray. And we have successfully, in fact, I think, challenged many of that bias, many of the stigmas out there that mental illness is too subjective. And so we've seen firsthand, I think, the impact of sort of a biased decision making and stigma attached to mental illness. There are many other legal challenges that people have faced during the pandemic in relation to mental illness. In particular, one can look at the relationship between employers and employees, because what happened was a change in really the dynamics. Many employers obviously downsized. Many were having a certain group of people attend the workplace if permitted, and some people actually work from home. And that shift in the paradigm made people feel very vulnerable, particularly those who have had pre-existing mental illness. So that has led to disputes with employers, workplace safety related issues, occupational health and safety related issues, in addition to termination, wrongful termination lawsuits. And remember this, we're not just talking about the effect on employees. Many businesses have suffered to the extent that many have simply closed. There's been bankruptcies. And we're talking about the small business owners who have really put their life's work into their business, their passion, they're really their sweat, their soul into it. We're talking about small restaurants and even clothing stores. We're talking about small retailers who have seen their businesses collapse. And obviously, when your way of doing things, your habit is taken away from you, in addition to the financial challenges, there are mental health concerns that arise, including responses to stress. There are many litigation claims out there with respect to what's called business interruption. Most businesses would carry a business interruption insurance to protect them in the event of unforeseen circumstances such as floods or fires, where there's going to be a period of time where those businesses are not able to earn money, and they paid into insurance so that their expenses, their employee expenses, et cetera, rent and things like that, can be sustained so that when the premises are fixed, they can continue on in business. There's been many challenges. Many insurance companies have simply said that these are not applicable for pandemics, and most cases are still, in fact, in dispute. And meanwhile, those business owners sort of have left hanging, and almost to the extent to have to give up and close shop. Essential workers, they really are heroes in terms of keeping sustaining the necessities of life that we have needed through the pandemic, and really put their own safety and the safety of their families at risk, really from the outset, and continue to do so. So, and there's sort of the traditional essential worker: police, fire, paramedic, hospital staff, doctors, nurses, and other staff that we speak about. But also often ignored are the frontline essential workers who have not necessarily been trained in dealing with crisis, in dealing with the increased adrenaline levels. And those would be our grocery store workers, LCBO workers, etc., who were open, often earning minimum wage, and really seeing the general public come to them every day, different people. Some are hostile with masks, etc., and having to day in, day out deal with this. And we saw many claims, people calling us about how to deal with their employer, how to make a disability claim, because they simply could not continue. And in the vulnerable situation they were, their anxiety was profound. They were seeking medication from their doctors for the anxiety and depression. And their biggest and a large worry has been their family. And, other professions that we've seen people come to, as many PSWs, they at the outset were looked at in terms of the long-term care homes, and many deaths, and those who contracted COVID-19 and passed to their families were in fact PSWs. And we've seen disability claims that have been denied, again, on the basis of insufficient medical evidence, when there really is real disability, where workers cannot even function in their day-to-day life. The stress level, the breakdown is so much that it's not just their work, but they cannot function at their home, in fact. Now, and I think this was alluded to in the other presentation, one of the changing dynamics of the workplace, even for office workers, has obviously been work from home. And this has caused, in the family law area, where people were sort of getting along, but hanging by a thread, and where there may be some abuse situations as well. So the beginning of abuse situations where people, particularly women, who are now in very vulnerable, precarious situations, and needing to seek the help of family lawyers to deal with their situation. In terms of access to justice, certainly at the outset, there was a cancellation of court proceedings, a massive cancellation. Already, there are inherent delays in the legal system, particularly in civil matters. So there was really, not, I wouldn't say a breakdown, but tremendous delays. Jury matters were postponed or eliminated. And I would say the court system has stepped up to the task in terms of having Zoom hearings, Zoom mediations, which my office, we do about 3 of those a week, each of us mediating. So we got very used to it, and actually has begun to enjoy it and think it's quite effective. But I see in the court system, I think what occurred over the last year and a half would have taken another 10 to 12 years if there was no pandemic. It would have happened, certainly, as the technological advances occur, inefficiencies can be eliminated. But what we saw in the last year and a half, in fact, was that rapid speed of advancement. There are some disadvantages. Some lawyers say, and I see it somewhere, when you're examining a witness and you're not there face to face, and they're at home, and you never know who's in the background, assisting them, etc. So there are some drawbacks, but we had to obviously make best and do with this. I'm often asked the question by media when it comes to the mental health disability claims. Well, what do you do? How do you help someone who's been told where there isn't sufficient medical evidence, and maybe where there's an insurance doctor who's never met the person and said, well, you might have something going on, but you can work. How do we address that? Well, the key I find is having a good liaison with the person's treating doctors, such as their family doctor, their psychiatrist, their psychologist, their social worker, because the evidence from those practitioners would likely be given more weight than someone who's been a hired gun, so to speak, to come up with an opinion. So I say it's important to people who are suffering from mental illness and disability, and who have claims that have been denied. Please keep seeing your physicians, because they make notes every time you go. And those notes are going to be released and shared with the insurance companies. And it is important, in fact, that there is a continuity of records. Now, I understand many offices were closed, but there are virtual appointments that can be taken. So that's one step that is very important to do. The next, of course, if with repeated denials is I wouldn't advise people to use the internal appeal process that disability insurers have. It tends to be very, very biased. Find a lawyer who practices this area, who can do a quick and efficient job of getting the case moving. And because often, once there's a lawsuit in these disability files, the eyes look at it a little differently. There's a lawyer involved for the insurance company, in addition to a senior claims specialist, and they look at the cases very differently, with a much more eager eye to resolution. And, I find that just the simple phone calls that people get from disability case managers on a day-to-day basis, send us this, send us that, critiquing, well, if you can do the laundry, why can't you work? Comments like that, it just makes things a lot worse for people. So I know in our practice, we're really satisfied when we see a client at the end of the day with the relief when we've taken care of them. Getting that satisfaction that we see in their eyes is very important to us. So that's where I see some remedies in terms of legal claims that have been denied is get allies. Allies include your treating physicians and social workers and psychologists, et cetera, to help you out. There always is a light at the end of the tunnel. Things are not always hopeless as they seem. There always is another day and a better day. And the more allies you seek, the better it is for yourself. Before I conclude, there's one element I want to talk about, and that is long COVID. Long COVID essentially is it's where COVID symptoms last beyond 28 days. And there are many people who have a subset of the population who is susceptible to long COVID. It may be their inflammatory response in their body. But the symptoms include, a feeling of what's called brain fog, chronic fatigue, there's depression, there's anxiety, there's body pain, and really tiredness to really get about and do daily activities, let alone work. There's been studies, particularly out of England, that have looked at how many people, in fact, have long COVID, and it is astounding. And to look at solutions and support groups, we were a bit behind in Canada. I know there were studies done out in Alberta. We're a bit behind, but we're going to see long COVID and for many years to come, and the effect on people who have long COVID and their family members is going to be profound. There's no question this pandemic is going to affect a generation that is growing up, that is youth, where they've had to change the way they normally socialize. It's going to affect them, and anybody who's been through this pandemic. It's a generational event, or maybe a two-generational event. The last time we ever saw something like this was in 1917 or 18 with the Spanish flu. So there are challenges, but there are also resources available to people, good people that we're seeing here today, physicians, and obviously the legal profession. If you need help, through lawyers who understand what COVID has done to society, and we do hope the best for everyone. I am the president of the board of Everymind, and I know Bhupinder is going to be introduced very soon. This is a great organization. The reason I became involved in it is because of the tremendous help they give to children and youth, and they're here in Peel, and the help they give to people in crisis, and they've literally saved lives. They've changed direction where people were headed. And you find often with mental illness, it begins with some trauma in childhood, and if it's not dealt with, if it's not treated well and not looked at, things get buried, and then later on in adulthood, you have, unfortunately, people who have difficulty in their daily life, in social life, and in working. So this organization, I think, is an amazing organization, and certainly look forward to Bhupinder's talk today. Thank you, Vipul.
Thank you for that, Nainesh bhai, and it was good to have a legal perspective, apart from the medical perspective as well. Because a lot of people may not really seek legal advice where they should, before it's too late. In many cases, it happens, people wait and wait and wait. And then by the time they approach a legal expert, it may be too late. So it's important to have this perspective in mind. Thank you for that. And so after the other two presentations or speeches, we will have a Q&A where we'll ask brief questions to each speaker. So now that brings us to our third speaker of the day. Let us, if we can bring up the profile. Heer, our next speaker. She is a clinical services supervisor and a manager at Everymind for the last 10 years. Her portfolio includes infant, child, youth, family therapy program, field infant parent program, crisis response services, Tangerine walk-in counseling, field inclusion resource services, early on child development support service, group services, and court clinic. Bhupinder has worked in the social work and early childhood field for the last 20 years. She completed her master's in social work in 2006 at Royal Holloway University in UK. She has a strong passion for early years, mental health, intervention, and treatment. So over to you, Bhupinder.
Thank you so much, and thank you for extending the invite for me to come and talk about child and youth mental health. So I have a presentation. It's a brief presentation that I'm going to be speaking to. So just pulling this up. Okay, so my presentation, it's a great kind of follow through from Dr. Hussain's presentation, where Dr. Hussain spoke about stressors for adults. And what I really want to highlight before I even start is that those stressors for adults filter through to impacting the mental health of children and youth. And again, as Mr. Kotak mentioned, Everymind Mental Health Services, we provide mental health services for children and youth in Peel. And he also touched upon the impact of trauma. And we know that trauma is a big factor in mental health, as well as adverse childhood events. So a lot of the time, we're really kind of educating our community, especially the South Asian community and many other communities, culturally specific communities, that children's mental health exists. Because a lot of the time, we don't actually realize that children experience stress too. So just kind of prefacing my presentation on that concept. So Everymind Mental Health Services were formerly known as Peel Children's Centre and Nexus Youth Services, and last year we amalgamated to kind of covering the whole age group, so 0 to 24, and we became Everymind Mental Health Services. Again, our kind of, the for you, with you means that we work together with children, youth and their families and caregivers to provide a service and create treatment plans that are individual and are specific to the need of the client, who would be the child or the youth. Again, up to the age of 25, which is the 25th birthday. It doesn't include that year of the 25th year. So we offer a range of high quality, free, confidential mental health services for infants, children, youth and young adults who live in the region of Peel, together as support services for their families as well. Everymind is also the lead agency for child and youth mental health services in Peel region. So we work together with other mental health agencies in Peel, such as Associated Youth Services of Peel and the hospital systems as well. So we've touched on the mental health impacts of COVID-19 quite a bit, but I just want to kind of focus on this slide specifically. So Dr. Hussain has covered probably most aspects of it. But what we do know is that COVID-19 pandemic has had a major effect on all of our lives. No one has really been untouched by the pandemic. And many of us are facing challenges that can be stressful, overwhelming, can cause strong emotions. And that includes children, youth, and adults. Again, we know that all of the changes in the first presentation that were mentioned impact adults, and if adults aren't coping well, if adults are stressed, that's going to filter down to the way that we are present for our children and youth as well. We know that public health actions such as social distancing and again the closures of many extracurricular activities, gyms, etc. They've been necessary to reduce the spread of the pandemic, but have also led to many adults, children and youth feeling isolated and lonely, and that in itself has increased stress and anxiety. We know that mental health existed for all of us prior to the pandemic. And the last 18 months, the unfamiliarity, uncertainty, not being in control, and the unpredictability of the last 18 months has all significantly increased the prevalence of mental health challenges. So we had a crisis before, and now really the mental health crisis is even bigger because of the pandemic. Again, as I've mentioned, and my biggest kind of message today is adult mental health does impact children and youth. And children and youth are actually experiencing increased levels of mental health challenges more than ever now than they were before. We also know that calls to mental health crisis lines for children and youth have increased by 110% between 2019 and 2020. And that's based on research that's done by Children's Mental Health of Ontario. So again, some statistics on child and youth mental health. A recent Sick Kids survey found that approximately 70% of children and youth reported a worsening of their mental health since the start of the pandemic. Children with no previous diagnoses are now experiencing higher rates of depression, anxiety, irritability, and inattention. Kids Help Phone reported receiving more than 4 million calls, texts, and clicks in 2020 from young people looking for support, which was actually double than the previous year. So again, that really highlights the prevalence and the increase in mental health for children and youth. 50% increase in youth coming to the hospital with eating disorders. And again, a recent CMHA report showed that the age group experienced the strongest worsening of mental health is individuals between the ages of 15 to 24. We have heard about youth who have died by suicide, with parents informing that the pressures of the pandemic was the driving factor. We also know that youth have missed out on major milestone celebrations, such as graduation ceremonies and graduation ceremonies for university, for school, birthdays, milestone birthdays, meeting up with friends. All of those things have impacted the effects of the prolonged pandemic. So again, focusing on the services that are available for children and youth. So we do provide services for children and youth, again, 0 to 24. That's up to their 25th birthday. And those families would be living in the region of Peel. Our services include assessment, treatment, and education delivered by experienced mental health professionals, which include social workers, psychotherapists, and when needed, psychiatrists and psychologists as well. And we work together as a multidisciplinary team to meet the needs of clients holistically. Every child, youth, or young adult's treatment plan is customized to address their individual needs and be responsive to their unique life and family circumstance. So the way that we do that is when a client is assigned a staff or a child and family clinician or a youth clinician, they would have 2 sessions where we're completing a thorough assessment. We use a tool that really kind of looks at all aspects of functioning. And then from there, and together with the child, youth, and the caregivers, we would determine a goal that they would want to work on. And then we would continue with the treatment, which typically would last between up to around 16 weeks. And again, if there is a need to extend that, we do have long-term programs as well. So depending on the need and the complexity, a program would be assigned to based on the need of that client. So we have various entry points, again, kind of ranging from crisis service to a walk-in program that's being offered virtually and in person right now. It's not true walk-in because of the pandemic, but there's really a tiered approach in terms of the least severity to our intake services, where they would assign a program that might be working with children and youth who have more complex needs. So our entry points to service, first of all, is where-to-start.ca. Any family or youth can call themselves to access services. And what would happen is that they would either go through the website, or they can call our intake number to book an intake to determine their need and the need for service. And that would lead to a session being booked, which would be around 45 minutes to 60 minutes long. And then standardized intake questions and the Inter-Eye Chime Screener Plus would be completed. Again, that determines the need, and as well as any risk and safety planning needs as well. So then, based on eligibility, program options would be discussed with the caller. And then the caller chooses service from the options that are presented. So again, that could be our infant, child and youth family service program, which again, the time frame for that is around 16 weeks of service. It's up to 16 weeks, depending on the goal. And we also have intensive services, which is a much more intense program for clients that are coming in with complex needs where they've accessed services before, but the success has been limited. And then we also have live-in treatment programs as well as day treatment programs. And I've only mentioned a few, and I'll go through some slides which will go through a more thorough service options. There are 2 other options which provide pretty much immediate access to service, but they are shorter and time limited in length. We have our Everymind 24/7 crisis response service. As per my previous slides, we've also observed that our calls have gone up quite significantly, especially for suicidality, anxiety, stress, and members of our community, especially youth and their caregivers, calling in to find ways to manage and keep our children and youth safe as well. So we have worked really hard in the last year to partner with the Community Mental Health Agency in Peel, CMHA Peel, to now offer one number. So it doesn't matter whether you're a child, youth, or an adult, there's one number to access crisis services. And that went live last month. And it's actually a really huge success for us, because we've been really working hard to make sure that there's one number and not 3 different numbers to access the same crisis service. So, and then from there, the caller would identify what age bracket they belong to, and they would then be added to the right list in terms of the queue to access crisis response services. So our crisis response service for children and youth is available by phone 24 hours a day, every day of the year. Calls can be initiated by caregivers, children or youth, and other community members such as school staff, police, or caseworkers. And mobile crisis visits, which are in-person visits in the community, are also available from 9 a.m. to 9 p.m. 5 days a week. So that's the Monday to Friday, but otherwise we offer phone services 24/7, 365 days a year. Supportive follow-up calls are offered after every crisis intervention, and then the family, the child or the youth can decide whether they want to take that up. And we also provide assistance to get connected to other services as needed. And that could include the client calling our where-to-start.ca to access one of the services that we offer. And it could also be other community services as well. So Tangerine Walk-in Counselling, again, we've had we've made huge steps in this portfolio as well, where we are now offering Tangerine Walk-in Counselling 5 days a week. We used to offer Tangerine Walk-in Counselling 3 days a week. We're in partnership with AYSP and Rapport Counselling Services. And as of the turn due to the pandemic, Everymind has been offering Tangerine as a sole agency. And as of April this year, we are the sole agency that's continuing with providing walk-in counselling. So again, as I mentioned, because of the pandemic, we're not open to walk-in, but we are open to registrations, and we can respond to any of the requests for a session within 5 minutes. So we have around 60 slots available every single week, where families who are requesting a Tangerine session would be assigned a clinician, and they would then proceed to have a 45-minute consultation, which would be offered via phone, video, or in person. And the caregiver or youth can request the appointment by visiting tangerinewalkin.com and completing a request form. It's a very basic registration, a request form, and then one of our intake staff calls the family to complete a registration, and then assigning a time slot for them to access a consultation. Following the consultation, verbal recommendations are provided to address the presenting concern, which again may include recommendations for other services. So Tangerine and crisis services are also open to anybody who might be on the wait list for service. And we know that due to the demand for mental health services, wait list is the reality for probably every mental health agency right now. So again, a little bit more about the services that we offer. So our services most of our services fall under 7 categories. The first one, and the least intrusive, is targeted prevention, which includes our groups, workshops, as well as webinars that are offered by our psychologists, which are designed specifically to help children, youth, and young adults and families understand mental health and how and when to reach out for help. And then we have brief services, which includes Tangerine Walk-in Counselling. Again, that's a single session counselling service for children, youth, and young adults and families who need immediate short-term support. And this is offered 5 days a week, with morning, afternoon, and evening appointments that are offered. Then we have a category which is counselling and therapy services. And again, infant, child, and youth family therapy program, our youth counselling programs. The key difference between the two is that there's the infant, child, and youth family therapy program involves the family as well, where the family has to be involved, especially for our younger clients, where the family has to be the one that drives some of the treatment. We can meet with the client 1 hour a week, and then the family supports that child or youth during the week. And then our youth counselling program is a program where youth can actually decide if they want their family or caregivers involved. And this the youth counselling specifically would can work alone with the youth as well. So those are the key differences. We have family capacity building and support, and this includes our group services that are offered throughout the year, as well as our Strongest Family Institute program, which is for children, youth, and families who are struggling with disruptive behaviors and anxiety. So again, we have a whole spectrum of groups, a whole range, which include groups that might be specific for ADHD, for anxiety, attachment. So again, on our website, you would find the whole range of group services that fall within family capacity building and support. So it's categorized under family capacity building because it's the caregiver who attends those groups. It's not a group that's specific for that child or the youth. So we have a couple of groups that are specific for our clients, which are the children and youth, and they fall under the previous category of counselling and therapy services. So we have an anxiety group, which is a therapeutic group. So that's why it falls under counselling and therapy. And we also have another program called Coping Power that also falls under counselling therapy services, which is a group program as well. So as I mentioned, we have specialized consultation and assessment through our psychologists and psychiatrists. This is not a standalone service. It's linked to the service that we provide clients. And if needed, then we would pull in psychology and psychiatry. And that could include consultations as well as assessment as well. I touched on crisis support services. So again, this is a free and confidential crisis line available for the community 24 hours a day, 7 days a week, 365 days a year, which includes holidays. And it's one number for the whole of Peel, which makes it easily accessible. We have intensive treatment services. And again, as I kind of mentioned, that all our services are based on complexity and what's determined at intake regarding the need of the client. These services support children, youth and young adults and families in their own home, as well as in their school or community, and sometimes in the out-of-home live-in treatment programs that we operate. Other services that don't fall within the categories is Peel Inclusion Resource Services, which is a partnership between special needs resourcing programs and licensed childcare providers that offer services to families and children before they start school. So children who are attending a licensed childcare program who might be struggling within the childcare program, we know that there's, again, the impact on our young clients has been huge during the pandemic. So when they're not meeting their developmental milestones in the childcare program, then we have a whole team that can go in and provide resource services for those clients. We also have early on child development supports. We know that a lot of money has been poured into our early on programs in Peel. And at Everymind, we have a team of early on resource consultants who provide consultations that support early identification and referrals forward to just kind of make sure that if there is a red flag, then those can be addressed early. So we're intervening early and support can be provided early to those young clients. We have a service called Wraparound, which provides individualized, coordinated, family-centered care to meet the complex needs of children and youth who are involved with multiple child, youth, family serving systems. We have a child witness program who provide information and support to children and youth who have experienced or witnessed a crime and are required to testify in the criminal court. And then we have the arson prevention program for children, which is in short called TAPSI. And this is a program that brings together the fire service and mental health professionals to work with children, youth and their families to eliminate dangerous fire-related behaviours. So we offer assessment and treatment related to fire setting. And again, just a reminder in terms of how to access services. Our website, wheretostart.ca, has a very quick registration form. Or there's a phone number where an intake can be booked, and any client from the Peel community, the family caregiver, can request an intake. Any family caregiver living in the region of Peel can access our 24/7 crisis line, and also Tangerine walk-in counselling. So those are our three avenues to accessing mental health services for children and youth. And just in terms of my details, I've just added them there in case anybody has a question after the presentation. And Bipulji, I can share my presentation with you, so if that needs to be shared.
Yes, absolutely, Bhupinderji. These presentations can then be sent, to other people, and even in some cases to some organizations, or even companies. And actually, I am so happy that today we had Dr. Maher Hussain, who covered the mental health and anxiety aspects for adults. And then you took care of the same aspects for kids and younger adults. So that practically covered the whole family, And whether it's an adult or whether it's a young adult going through depression or anxiety, mental health, it affects the family regardless, So thank you, both of you, for this presentation. And let us then go to the next speaker, Anupma ji, and I believe she has to go after the presentation. So we have one question for each of the speaker. I mean, if you can stay back, I will ask your question first. Then you can address the question, and then you can go. Right. So, Tejas, if you can bring up her introduction. Anupma Sharma is the president of Sunoh, helping international students cope with mental health, addictions, and human sex trafficking. She has a not-for-profit experience over 20 years working within the settlement sector, youth, as well as with survivors of domestic violence. She has been on various boards, including ACO, or AIDS Committee of Ottawa, CASA, PCHS, as well as Sahara Services in BC. Anupma worked in the labor movement for 12 years, working on bringing changes to precarious workers in the property services sector and healthcare sector. Currently, she is a member of the Toronto chapter of the Punjabi Chamber of Commerce. As I mentioned, she is also the president of the board of Sunoh, which helps international students cope with mental health, addictions, and human sex trafficking. International students, I mean, especially at this time, Anupumaji, we all know international students coming from India are undergoing a tremendous amount of stress because of the flight bans and third country arrivals and visa problems and a lot of issues. So what you are doing right now is really very helpful for the students of India. So over to
Thank you, Vipulji. So I just wanted to thank you for giving me the opportunity to talk a little bit about Sunoh. So I know everyone's touched upon adults, children, as well as youth. So we started Sunoh roughly about 2 years ago. I have two other partners with me that put this organization together. The reason why we started Sunoh prior to the pandemic, we had realized that there was, on average, since 2015, at least 3 to 5 international students, predominantly from India, that were suicidal. On average, 3 to 5 students have commit suicide from India since 2015, and we've seen an increase of that during the pandemic. We came together as an organization because we know that other community organizations have come together to support international students, but there's almost twofold as why we started this organization. The first was to bring awareness into the community, and B was to let them know that there are support services for them. So, I think with the pandemic, the isolation across the board, I don't want to repeat a lot of what the other presenters have talked about, but with the international students, their support system is either back in India or their peers that were within school. So when you look at the pandemic, they can't travel back to India. And if they do, they can't come back here. And then the second part is the schools are closed. So their isolation, which was already taking place once they arrived here, they're isolated from their families and they're isolated from their peers, as well as their classmates, etc. So their only sort of outing was to go to school if they weren't working. And that's been sort of taken off the plate for them, so to speak. Nainesh had actually talked a little bit about the frontline workers during the pandemic. And if you were to see a lot of the fast food workers, a lot of them are the international students. You've got security guards. So a lot of the precarious workers, that the jobs that are doing are by international students. So here's students that know that they need to work in order to pay for funds, send money back to India, but they're also putting themselves at risk by being frontline staff. And, a lot of the jobs that other people wouldn't do, the students were gladly taking it because they need to work. So I think this affected mentally as well as physically, putting themselves in harm's way, so to speak. If there wasn't access, a lot of them might have health coverage, but it's very limited. So in terms of their long-term effects in terms of their health. It's layered based on what everyone else that has been affected by the pandemic. So a lot of the mental health that these students are facing, also getting backlash, getting a lot of people who are taking out their frustrations on the frontline workers. So these students are taking a lot of the brunt of what's happening, what has been happening for the last 18 months. You know, we've talked a little bit about the support services for these students, but I do want to kind of reiterate. So a lot of these students are coming at the age of 17, 18, having a lot of responsibilities put on them, their parents taking loans and putting on debt in order to send them here. So they are dealing with being isolated, the pandemic, having to work, and also having to send money back. So a lot of these students, if they're not able to work, to go to school, there is the chance that these students are turning to drugs, turning to alcohol, and getting severely depressed. So I think it's important that the students know that there are services and there are resources out there for them. Now, the only catch is, and I know that this is something that is going to take some time, but the federal government doesn't provide funding to provide services for these students. So a lot of these students, if they were to need mental health counseling, addictions counseling, they would be having to pay out of pocket. So that is why we developed Sunoh. We're a charity. So what we're doing is we've partnered with organizations that will be providing the mental health and addictions counseling, and we would be raising the funds in order to help provide those services free of cost for these students. It's a luxury as someone who's born here that I take for granted. And I think for these students, having to deal with issues that all of us are affected by, and not having the money to pay for it, I think is an issue in itself. So I think, the organizations that we partnered with are doing this pro bono and providing services for these students. But we also are looking at these students. What I've noticed is that they are very well connected. Their network is very strong. So once the international students know that there's someone out there to help them, that information spreads very quickly. And I think, a lot of the students are coming here and getting taken advantage of by Canadian-born, I would say South Asians. So there's a lot of mistrust within the community. And that awareness is what we're working to build on, because we want them to know that there are people and the organizations that are there that they can trust and that are not going to take advantage of them. So we are also looking at partnering with organizations that provide cultural sensitivity and culturally specific services. So for instance, a lot of the colleges and universities that they're going to have these services for international students, but are not in Punjabi, Hindi, or whatever other language that they speak. So we have trained international student volunteers. So I think it's really important to have someone that has been on that journey to provide them services, rather than someone who can tell them, oh, by the way, I heard that this had been taken place by someone else, but they have experienced it. So we've trained about 20 international students that have been here anywhere from 2 years upwards, that have graduated from the social work field and other fields, who want to be volunteers and mentors for the students that are going through these issues. As well, I think it's important that that there's an outlet for these students. So what we've been realizing and noticing lately is a lot of these students are turning to hobbies, as Dr. Hussain had mentioned, but these students are using music, using podcasts, using spoken word as a way to talk about their issues, and in order for them to kind of cope with it. So I think they're using a platform that they know, social media, TikTok, etc., has been readily available for them. And I think for them, it's a way to connect, release the frustrations and the concerns and issues that they have, but it's also a way for them to build their confidence too. Because for the last 18 months, I think Toronto and like the GTA has been one of the longest cities that have been under lockdown in North America. So, people have come up with really inventive ways on how to cope. And I think a lot of these students have used these social media platforms to connect with others, but and also to express themselves. As I mentioned, so I've had a lot of students, international students, reach out to me about volunteering. So this is a way for them to volunteer, even if they can't go out and connect with others. By helping others, it's making them feel better and cope with the isolation. At least, as we're on a Zoom call, this is a way for them to be able to be face-to-face with others if they physically cannot be. And I think it's also important, and each of these speakers had mentioned this as well, that just talking, right? Having someone, like, pick up the phone. Do you need to text someone? Even having a support system where, another student tells another student, hey, this is what's going on, I need your help. Not getting to the point where a student feels like they have to take their life in order to cope with this. So this is sort of, I know I've condensed. I don't want to repeat a lot of what everyone else has said, but the international student journey is very unique. And I feel as a community, we need to know that there's a lot more that we can do, rather than just think, okay, these students are here on their own dollar and all this stuff. There's so many other issues that are happening. I know that we're dealing with human trafficking and sex trafficking. I'll go into that really quickly, but a lot of the students are coming in here that we've known, especially a lot of the young females, are getting into relationships with Canadian-born guys, and they essentially are getting their passports taken away from them and forced into sex trafficking, because these guys are kind of holding it over their heads. If you don't do what we tell you, we're going to call your parents and let them know what you're doing, and using shame as a tactic for these young girls. And while they're being forced into the sex trafficking, they're also being given drugs and alcohol just so that they're numbed by it. So, a lot of the times our community thinks this is happening in other communities, but I wanted to bring it to reality that this is actually taking place within the South Asian community. And there needs to be sort of a support, I think, rather than us turning our backs to them, because we all, either physically, if we didn't come, our families came as immigrants here. And for me, I know what I was doing when I was 17. I wasn't traveling halfway around the world with the weight of the world on my shoulders. So, I think one of the asks that I have, that if we can support the students, is, if we see a student struggling, or we know of a student that needs our help, there's organizations that are there to support them. So that's my presentation.
Thank you. It was very different, actually. Honestly speaking, we hear stories sometimes of financial exploitation of international students, where they are working. But there's not much discussion about human trafficking or sex trafficking in particular. During my 15 years of running a newspaper in GTA, I remember a few years ago, 3-4 years back maybe, there was some focus on this issue. But since then, again, it has gone off the radar. So, since you have to go, I will ask you my question first.
Sure.
How bad, honestly, is this problem? That's number one. Has the pandemic made it worse than it was before? And lastly, international students use WhatsApp groups to communicate, to share some services, rental services, accommodation, food, a lot of stuff. They tell each other by joining various WhatsApp groups. So is there any such WhatsApp group to address this issue?
So I'll start off with that question first. So in terms of the WhatsApp group, so I've noticed that there are Instagram groups, right? And then a lot of the words that they've used for the Instagram groups are very entertaining. Just like the terminology that they've used. But I think it's interesting that you brought that up, because I have contacted a lot of these like Instagram groups, and the first question is, what's in it for you? Right? So when I mentioned that a lot of these students have been burned by South Asians that are already here, a lot of them can't fathom the idea that someone wants to help them without anything involved, right? So a lot of the international students that I've connected with have essentially talked to their networks. So I'm on a few WhatsApp groups, but those are students that have met me, talked to me, and have vetted me, so to speak, with the other students. So the groups that, I've done a lot of focus groups with hundreds of students, and what we've done as Sunoh is we've developed resources. So I could talk for hours about the issues that these students face, but when a lot of the students come to the airport, they're told that a relative is going to pick them up. No one picks them up, right? So their first interpretation of coming to Canada is isolation, right? So what we've developed is a network so that someone's going to pick them up from the airport. They're going to be in a hotel or accommodation. We're going to make sure that their food is delivered to them that's culturally specific. And we've helped network with lawyers, with employment agencies, all of the resources that these students have need. We have developed those, right? But what we're doing is we're partnering with organizations and universities in India. So when the thought comes to these students, hey, we're thinking of coming to Canada, we are doing webinars and having conversations with them on what to expect when they come here. But we're not just doing it with the students, we're doing it with the parents as well. Because a lot of the pressures, the mental health that these students are facing is due to pressures placed on their parents. So the first question you asked, this situation, I feel, is going to become a crisis. It's headed to a crisis level already. So we started this organization 2 years ago, and every month that goes by, people are sending me screenshots of these students starting GoFundMe accounts because their body needs to be shipped to India, right? So 3 to 5 students a month, and that's just here. We're just talking in Ontario. If we were to look at, across the country, how many students this is affecting, this situation is just getting worse. And I feel with COVID, you're looking at the suicides because there's no work, because they're not in school, because of the pressures. But then also you have the drownings that are happening, right? Anytime I see on TV that there's a drowning that happened in Wasaga Beach or up north somewhere, the first thing I think of, it's an international student, and lo and behold, a couple hours later, there's a GoFundMe page for the student, right? So this situation is getting worse because of COVID, absolutely. And I just feel that, working in the settlement field, this is the new settlement sector. Settlement sector now is international students. That's where the federal government is making most money bringing these students in. But the training, the education, the resources, all of that has not been put in place.
Okay, so I think it will be important for us also, as I said in the beginning, we are just about at the time, so I will be quick. There's one question for each of the 3 speakers. But before that, Anupma ji, as I mentioned in the beginning, we are also running an education forum. And over the last 2 months, we have brought together, as I mentioned, presidents and deans of colleges and universities from Ottawa, from Calgary, from Montreal, from Vancouver, from Toronto, from Michigan, from Haryana. There are big colleges and universities. So I think maybe we can pick this issue as one of the topics. They all talk about how good it is, but nobody addresses these issues. So I think it will be important for us to include that as part of the education forum as well.
Please. That would be great. And I apologize that I have to leave. I just have a newborn that's just been crying, so I need to.
Right. No, we understand absolutely. Thank you for giving us the time. And, so you are free to go. Okay. So I will do the question and answer in the reverse order. So Bhupinder, you are next. In your experience over the last 16, 17 months, how much will be the permanent or long-term damage to our youth from this pandemic? I mean, what do you think? Is there still a stigma preventing the youth, especially the South Asian youth, from reaching out for help?
So I think that the long-term effect in terms of the mental health increase that we've seen over the pandemic really is dependent on how quickly services are accessed. Because I think that if mental health services aren't accessed, then yes, there will be a long-term effect. What we know is that the wiring of our brain changes with stress and anxiety and mental health. And with anxiety and stress, if we kind of leave it, it becomes something much more serious, right? So I think that other diagnoses, as Nainesh had mentioned, can be triggered by the unaddressed stress and anxiety. So I think that the answer to the question really isn't simple, because it's dependent on whether services are accessed, whether physicians are contacted, if medication is something that may be helpful. But yes, absolutely. If the right supports aren't there, and if the stress, the period of stress is prolonged, and anxiety and depression, then of course there will be a long-lasting impact. What we know is that that stress, anxiety, and trauma, mental health, if not addressed, it kind of runs through generations. It becomes a cycle, and that cycle can be hard to break if supports aren't accessed. Again, with domestic violence, with stresses that impact attachment, we know that when there's a disruption in attachment as early as the point of birth, or even a traumatic birth in itself, can impact how children develop and how children grow, because it impacts the wiring of their brain. So all of those pieces, if left unaddressed, and if that support isn't available for children and youth to feel safe and to feel that there's stability in their life, and will kind of go on to be quite a trajectory that can have quite poor outcomes. In terms of the South Asian community, over the last 10 years that I've been here in Canada, I've done a lot of work, including with Punjabi Community Health Services as well, to raise awareness of mental health in our South Asian community. And I know that there's still a lot more work to do. We know that even with Anupma ji, who spoke about students coming from India, mental health really isn't recognized as something that we all have. It's seen as, if we kind of interpret mental health into any South Asian language, it's quite derogatory terms. If we watch any kind of TV program that is, where mental health is, mental health is portrayed very negatively. So there's a lot of work that I would say needs to be done. A lot of the time that where there is a concern that's raised by a family, typically they go to other support services, informal support services, like family members, or like people related to the religious establishments that might not actually understand mental health themselves. And sometimes it's hidden. So, it's kind of, it's shushed really, because it's said, okay, we can't talk about that because it has an impact. It has a familial impact, because we know that in the South Asian community, if there is anything that might be, that might put a negative light on the family, it's going to impact potential relationships or potential arrangements of marriages or things like that. So I think that in terms of mental health, especially identifying children's mental health, there's still a lot of work to do, but I think we've also made a lot of progress, especially with culturally specific mental health agencies that support families to understand, and community events. And we would welcome any community provider to kind of ask us to come and present on mental health, because what we try to do is kind of make it very culturally specific. In our community, we kind of base it on the symptoms. So my heart's beating really fast, or I can't focus, things like that. So we make it very culturally specific. So we break down mental health without using the actual words that deter people from our community to access services.
Sure, absolutely. So, I mean, as I mentioned, there is a lot of stigma, as you also addressed. Anything to do with mental issues, is considered pretty bad. And I mean, there was recently last year, I believe, there was also a Hindi movie, the film, with a very, very well-known leading actress. The name of the movie was Mental Health, yeah. Was Mental Health, yeah. Well, I mean, the name itself, as if you have some mental issues. I mean, it just adds to the stigma. So I think we also need to reach out to celebrities sometimes to be more aware, of what they are doing, what they are talking about. It will only make the problems worse for those people that are already suffering. So thank you for that. My next question is for Nainesh Bhai. Nainesh Bhai, as you mentioned, what the pandemic has done for the legal system, maybe, it has hastened the process, maybe advanced it by 10, 12 years. However, has the pandemic also created new and bigger backlogs in courts? Are cases now being prioritized while others are being tossed out earlier? And lastly, what has been the effect of pandemic on lawyers? Because in India, in Gujarat right now, lawyers are now starting to boycott the courts. They are not allowed in court proceedings. And, a lot of assistance is now being provided to lawyers themselves who are struggling. So how is the situation in GTA?
Right. So, very, very good point. Yes, there had to have been a prioritizing of matters in courts. And, it seems that the criminal matters get prioritized because of the charter rights that accused persons have and the risk of their case being stayed due to an undue delay. So they certainly were prioritized. Jury trials in certain matters did continue with glass panels and things like that to protect. Where the cases where that have either been just held in abeyance or excessive delays are civil matters, which are, very important, where people have been waiting for trials for some time. Those have been injured or waiting for compensation, certain benefits. And there already are delays. Obviously, it's not like India's, but there is delay. And certainly the pandemic has made this a lot worse for people. Cases could be going to trial one day, and then that you show up and it's adjourned into abeyance. So yes, that is a really significant problem. I think there's certainly been committees and relatively fast action on behalf of the judicial bodies to try to get things going. I do see some of the insurance companies have taken advantage of it in a way to get things delayed and to insist, for example, on a jury trial. We know we can't have a jury, on those who are suing are trying to have those juries eliminated in civil matters so that the case could be heard. And to have insurance companies resist that, knowing that it's just simply causing delays, is, in my view, unconscionable. There has been a great effect on lawyers. You'd asked that in the second part of the question. Lawyers, we're just everyday people who went to law school and practiced with a passion. So obviously, for certain areas of law, there's been a downturn in business. There has been the essential requirement of being remote, and some of the big firms were ready, were already in terms of their technology to be able to do this and do this quick. For sure, there are sole practitioners, small firms that encountered a lot of problems. As we know, March 14, 2020, I know that the announcements were starting to be made. A week later, there was a shutdown. Now, law offices were deemed to be essential services and you could have them open, but obviously there's safety issues, particularly during the early onset of the pandemic, where it became impossible really to see clients in person. So I think obviously the effect on law businesses and even the mental health of lawyers have been significant. What we found in our practice is that clients understood, and we've in fact been able to represent clients then throughout the province. They no longer ask you, where's your office, right? So there's that understanding, and that sort of on my side, we sort of looked at it in a way to open the ability to represent clients throughout the province as opposed to just in the GTA, because that would be the driving distance. So there's different ways lawyers have had to deal with marketing, advertising, and strategy and obtaining business, and how to effectively service their clients with the use of technology, and not being able to see the client face to face. So lawyers have had to adapt. It's obviously affected certain areas of law more greater than other areas of law. But you find, as with any business, many lawyers are entrepreneurs and found a way to adjust. But certainly, I think there have been pressures on all aspects of the judicial system, including the practice of law.
Good. Thank you for that. Dr. Hussain, Maher Hussain, we talk about mental health and anxiety issues in general public, but what about the same issues in healthcare professionals? And do you think they are now taken care of a little better than they were last year?
Yes, healthcare professions, they have also been very badly affected by this pandemic. A lot of mental health issues because of the stress and also exposure to the COVID-19, and a lot of people from healthcare professionals, they have died and died because of the COVID-19. To give you one example, so my background, I am from India, from South India. Three of my classmates from my medical school, three of them, the three doctors, three of them have passed away because of COVID-19. So that's so bad the situation is in India and many parts of the world. And even in Canada, we find a lot of healthcare professionals who have been affected because of COVID-19 and who have passed away because of COVID-19. It's a big sacrifice on their part. And also, I do find, like Mr. Nainesh mentioned, we do also work with the legal system. A lot of people with mental health and addiction issues, they get into trouble with the law. They get charged with offenses such as drinking and driving, violence, domestic violence, and other anger and violence related issues, and other alcohol and drug related issues. Now we find, and also because of the COVID-19, we find a lot of them because they stay home. There's a lot of relationship issues and domestic violence. We do receive a lot of clients for this domestic violence. People with, we get referrals from the legal system where people, they are mandated to get counseling and treatment as part of their legal conditions. We do get many clients with these domestic violence issues, and also like Ms. Bhupinder mentioned, we also do get a lot of for kids and adolescents with mental health issues because of this pandemic. That's all I wanted to say. Thank you.
Sure. So, Tejas, do you have anything to ask anyone? And as we are 10 minutes over time, so I think we'll keep it very brief. And then I will deliver the closing remarks.
I'll just have a quick short question for Mr. Kotak, sir. With this increasing focus on mental health and the increasing cases in terms of litigation and so on, just as environment has become sort of, now you now have environmental law as a sort of subject. Do you foresee or expect mental health law to become a subject as well? Is that something that is desirable given the current trajectory and the importance of mental health, especially in terms of litigation?
Yeah, I think it would be a very good idea if there were programs offered, in fact, in law school, to prepare lawyers, when they get into the workforce, to be able to help those who suffer from mental illness. because honestly, most areas of practice involve interaction with those who are going through stress, anxiety. Anybody who's going through the legal system has an inherent stress to first of all make that call, make that visit, and certainly particular areas of law, whether it be criminal law, family law, or even what I do, the disability and personal injury law. Most of the clients have mental health related issues, and I think some training, in law school. Or through seminars and webinars that can be done through the legal profession, where we have people like Dr. Hussain who would speak and lecture to prepare young lawyers coming into the practice, and even senior lawyers to be able to help clients who are in distress. I do see this happening, and I think it would be very important to have that discussion occur at all levels of education for lawyers. We see that happening with police, for example, and I certainly think amongst lawyers, because it's very important to be able to understand some of the issues clients may be having, not only in their legal matter, but in terms of the communication that we as lawyers have with them. How to address their concerns, maybe there's suspicions and things like that. So having some sort of training or background would be really useful for lawyers. It would help our own practice as well. It would decrease the frustrations levels that we sometimes have in not understanding the manner in which the communication is occurring. So I think that I do see it as being extremely valuable, yes.
Thank you. Vipulji, over to you.
Sure, okay. So before I deliver my closing remarks, I would again like to give 30 seconds to each speaker for your closing remarks. If there is something that you picked up during the discussions, anything that you have not addressed, here is your 30 seconds of closing remarks. Starting with Nainesh bhai.
Thank you, Vipul, for having me and allowing me to deliver a closing. And I think the real message I want to get across to people is there is help. Those who are suffering increased anxiety and depression for whatever reason, but obviously we're talking about the pandemic. I just please know that there's help out there, whether you have legal issues, whether that we need counseling, whether medical attention. Please research and seek out that help, and don't remain in isolation. Sometimes the battles do seem insurmountable, but they're not with the right help. That would be my message. Thank you.
Dr. Hussain, your 30 seconds closing remarks. You're on mute. Okay, go ahead.
Thank you for providing this opportunity. It's nice meeting all of you and participating in this discussion. Thank you very much.
Bhupinder.
I think just what I'd like to emphasize as a closing remark is early intervention is really important. If you are worried, if you have a question about your child or youth's mental health, if they're stressed, if they're not presenting as themselves as they typically would, just call. And even a question can can lead to kind of having some options in terms of how to support your child go through stress or anxiety. And I think early intervention is key. So like Nainesh said, that there's services out there and there's various levels of services. Just pick up the phone and access the service.
That's it. So that was session 5. I am sure today's discussion will provide useful info to residents and businesses alike. We have extended the session by about 20-25 minutes because of the wonderful information that we are collecting today from our speakers. The edited YouTube video will soon be posted on all our social media platforms as well as on our website. Thank you to all our speakers today, Dr. Maher Hussain, Nainesh Kotak, Bhupinder Heer, and Anupma Sharma. Both our partner organizations, Sunoh and PCHS Foundation. Teachers, if you want to bring up that sponsor slide. A special thank you to City of Brampton's Advanced Brampton Fund, Truly Financial, Tangentia, Greens Life Sciences, Best Ayurveda, Dentistry on 10, Blue Umbrella Financial Services, Process Research or Tech, and Kotak Personal Injury Law. Without your support, we would not be able to do this. And there are still 7 more sessions to go. So we'll be bringing together at least 60 to 70 more speakers from various other organizations. So anybody that finds these sessions useful, if you want to support us, you can email us at Canada India USA Development Forum at gmail.com to participate as well. So with that, session 5 is now formally closed, and see you all next week, the audience, for session 6. Thank you very much.